Okay, I thought I'd just run through very quickly the Center for Miracles and what we do. This is really our local San Antonio region numbers for 2012. You may have seen this in some of the recent publications that have come out. But as you can see, the sexual abuse is about 727. But all the other kinds of abuse and neglect, particularly neglect, are much higher. And Center for Miracles, we're really geared towards trying to assess children who are victims of any of these types of abuse, where the medical assessment may contribute something significant to the investigation and the services that are offered to the family. So this is our general purpose, is to provide timely, accurate, and comprehensive medical assessments of children who are suspected victims. And this is what's key. So I'll show you some other slides, but a lot of what we see is not abuse in our clinic. And we consider it a very prime goal for our clinic is to identify those cases early. Because if it's based on medical evidence, we better be very sure about the medical evidence before it goes further. And so that's why we try to get them in within 48 hours pretty much in our clinic. This is Dr. Lucifer. He's one of our physicians at the clinic. So what we do is we have complete medical assessments of children, but also siblings. If we have a pretty high-risk case, if we have a baby with abusive head trauma, we're going to want to see the other kids in the home too. And it's nice to have a service like that to do, like this to do that for, because we really didn't have that before Center for Miracles. We have short-term counseling. We have counseling students from Our Lady of the Lake, and they rotate through every year, but they also provide free counseling for our families on more of a short-term basis. We have inpatient consultation, testimony. We do a lot of work with pediatric radiologists, surprising the number of errors that are made in reading x-rays. And so we just really are very attentive to details to try to make sure there really is a fracture there or there isn't. Anyway, we have a pediatric nurse practitioner, and she works with our Failure to Thrive kids and families. So she's really the long-term care provider for the kids that we see. So we joined the sexual abuse from child safe together with everything else at Center for Miracles. It's worked out very well. We're able to do blood work more readily in a hospital setting. But the other real neat thing, and I'm very enthusiastic about, is the HPV vaccine, the new vaccine. Our kids are very high risk for HPV because of what we know about the types of sexual interactions, that they tend to be sexually active earlier. So we're trying to make sure all our kids are vaccinated and protected against cervical cancer. So that's been another nice thing. We pretty much stayed the same numbers since our transition, so it looks like we're not losing too many patients that needed to be seen. So we've seen over 10,000 kids since we opened in May 2006. Last year was our busiest year ever. We saw almost 2,000 children that came through the clinic or consult, like reviewing medical records, so one or the other. This is the three physicians that work there full time. Dr. Narang, he's going to be leaving us this summer, unfortunately, but Dr. Lucifer has been there since 2007, and then I'm there full time as well. What we want to do is be very accessible to people that need us. So we have encouraged providers to call us if you have questions, and there's one of us in the clinic all the time, so we will talk to you if you have questions. I'm also very good about emails. I tend to be on email a little bit too much, but even in the evenings and stuff, I will answer questions that come through that way. We also, we're kind of another set of medical eyes. So even if we have a physician that is making a diagnosis or referral to CPS, we still review all of those cases as well. So in fact, that's a lot of what we do, is doing a secondary review. There are two grants that we have that allow us to do the kind of work we do at Center for Miracles. One is called the Forensic Assessment Center Network, and this was set up in 2007. We are one of the 8 or so groups in the state that provides medical expertise to CPS specifically. So CPS has their own website that we share with them, and they can post their cases on the website, and they come out to us, and we go in and do the analysis of the data. So we're, again, doing everything we can to be very accessible to them. We also, the grant funding allows us to go to the CPS regional building twice a week, so Tuesday afternoons and Thursday afternoons, and we schedule 6 cases for review. These are serious abuse neglect cases that we schedule. I'll talk a little bit more about that, but that's been a very effective initiative, and it really is facilitated by CPS. It's designed to look at all the details of a serious abuse neglect case. We have expert testimony. We frequently go to court. Either it's a CPS hearing or it might be a criminal case that we go to, but we also provide training for CPS caseworkers. This is part of the training that we do. I got a video, and I don't know if it's going to play. I'll play just a little bit of it. But we designed a little program to help investigators, CPS and law enforcement, what mechanisms of injuries are. So what we were seeing is that we get these kids with these injuries, but we don't have a lot of information about the scene or the incident or how he fell. And our investigators aren't doctors, so they're not sure what to ask. So we created a program to help illustrate how abdominal injuries happen, how certain kinds of fractures happen, so that when our investigators are at the scene, they can gather the information we need as physicians to see if the explanation reasonably explains the injury. So we've got this little DVD, and we're putting it online available. There is an audio on this, but you're not hearing it. So it basically shows, this is an abdominal CT, and it's showing an injury to the liver in a child, and it's showing an injury to the pancreas in the child. So it kind of walks them through it. It comes in an iPhone app, so they can also buy that. It demonstrates ways that intra-abdominal injuries can occur, both through accident as well as abuse. So that's how this works. Okay. The other grant we have is MedCares, and MedCares is designed to try to reach out to our frontline providers, reach out to our physicians, but also reach out to other places in Texas that may not have programs to evaluate kids for suspected abuse and neglect. And our goal here is to try to mentor those places and provide education and support, because the kind of things that we learned here in San Antonio through our review have led us to understand that this isn't the same kind of analysis that goes on in other places, particularly rural areas of Texas. So we're trying to find ways to get that expertise out to those areas and support programs that are developing in their own communities. So right now we mentor a program in Kerrville, and they have forensic nurse examiners. So we are helping them not just see the sexual abuse, but also transition to physical abuse by taking photo documentation. That's just an example of trying to support and build other places. So here are some of our MedCare centers of excellence, as well as our outreach sites that are going on in the state. We spend a lot of time identifying false positives, and again, I think that's really a big reason why we've been able to get continued funding for our project, because we are as dedicated to identifying those that are not abuse or neglect as we are to trying to identify those that are. This reduced tremendous costs to the system. It's a cost-saving initiative, cost of investigation, legal proceedings, but not to mention family anguish and the intrusiveness that an investigation can sometimes have for families. So we identify serious injuries with a high likelihood of abuse and neglect, and our goal is to be sure that the child is safe. Be sure, more importantly, our goal as a medical is to make sure that the investigators understand the medical information. To be honest with you, CPS and law enforcement hold a lot more information than we do. We're one piece of it, but our job is to make sure they understand what our piece is, what the mechanism of injury is. Is it a severe injury? What's the prognosis for the child? All of those things are our responsibility to address. We also, by this outreach education, we're trying to facilitate better reporting decisions by healthcare systems and schools, and that would further reduce costs. I'm okay with people reporting if they have a little bit of suspicion, as long as we have a secondary review. You know, I think that's the way you catch it. Is that even if they have a little suspicion, it's just getting that secondary review and getting that additional information. is a good system. But right now, in most places in Texas, you just have that initial report. And sometimes you have communities that report everything, and some you have communities that report nothing. So that secondary review, which is where we come in, is I think the better system to have when we can get it. These are just examples. I want to give you some examples on both sides of the coin. This was a young baby that Dr. Lucifer ended up seeing, but he was taken to the pediatric dentist because he had this lesion under his tongue. And you kind of see this little white patch underneath here. Well, that's an injury. That's actually a torn piece of tissue under the tongue. The pediatrician didn't know what it was, send the child to the dentist. The dentist said, well, that's trauma, call Center for Miracles, and the baby came across the street to our clinic, and we did a skeletal survey, and we identified 5 fractures that were highly specific for abuse. Small injury, big outcome. And that's how it is with abuse. And most injuries associated with physical abuse are very subtle. Most of the injuries that are specific to abuse are very subtle. The kinds of fractures we see, sometimes the places where we see injuries are very subtle. Pictures are worth 1,000 words. We have a wonderful forensic nurse examiner program at the Children's Hospital of San Antonio. These are highly trained 8 nurses, initially trained as sexual assault nurses, now trained also as forensic nurses, and they take photographs. And it really is true. For some of these very egregious cases, like this one, pictures are worth 1,000 words. You don't need me to come to court and tell you that this child has numerous scars from being hit with an object. And these are disfiguring scars or permanent scars. She had ligature marks around her wrists and ankles. She had been hit with a wire hanger on her back. She'd been gagged on the sides of her mouth. That's what you see the scar in there. So on the other side of the coin, in terms of false positives, most commonly we have differences in interpretation of how the injury occurred or x-rays. Most of the injuries that come into us as suspected abuse, you have 2 big things to consider. Is it an accident or is it inflicted? And then after that, we're looking at rarer causes for bruises, like bleeding disorders or skin conditions that might mimic bruising and things of that nature. So most commonly, we'll get an injury and we end up saying, the explanation does reasonably explain this injury. When there's a difference, that's where we go. But sometimes, as I mentioned before, it's the x-ray. It's a difference in how the x-rays are interpreted. We look at all of our x-rays. We don't rely on the piece of paper. We look at them and we review them again with a radiologist. So our goals are to detect victims earlier and prevent serious abuse and neglect, and to detect those false positives earlier. So we work very closely with the Children's Hospital of San Antonio as well as all the investigative agencies. Just to remind people that it's not just identifying abuse, but we also have initiatives for before abuse happens, when abuse is suspected. We have an outreach education effort. When it's reported, I mentioned that's a lot of the work that we do, and then we provide testimony and education. This is an interesting slide. We started to track a little bit about our outcomes with those staffings that we've been having at CPS. And these are the overall numbers, but basically we started having serious abuse neglect staffing in 2009, I want to say, but we tracked what happened for a year, or almost a year, from 11 to 12, and we staffed a total of 206 cases, and our recidivism rate was pretty low. There was about 3%, which is lower than the average overall rate. So we feel pretty good that we're doing due diligence with these cases and that we are identifying cases that require more significant interventions. We have outreach programs, as I mentioned, seminars. This is our website. If you're interested in going to that, there is a video for new moms here, and we do show that at the hospital. It's kind of like a shaken baby prevention, but it's not just shaken baby. It has to do with just taking out your anger on baby, because it's not just shaken. It could be hidden. It could be anything. So we try to give guidance to particularly new moms and dads about how to handle those frustrations and lack of sleep, taking the time out. So we do have some materials on that. Okay, I just want to kind of give you an overview of that. And when you're on your way out, I think there's going to be a little handout about how to contact us, including my email, which is my preferred way of communicating. I tend to respond pretty quickly if you have a question that you want to ask me. Thank you again for your time and attention today.